When your dog has a seizure for the first time, it's scary. And when your vet starts talking about medications, it can get overwhelming fast. Why this drug? Why not that one? What does it do? And how do they even decide? Let's walk through how veterinarians and canine neurologists choose an anti-seizure medication, and I'll explain it in a way that makes sense. I've been through this with my own dog, Ruby, and I want you to feel confident and informed. Welcome back to Learn with Ruby. I'm Mandy and my dog Ruby has epilepsy. This channel is all about sharing what I've learned over the last 8 years of caring for Ruby after her epilepsy diagnosis to help you feel confident and supported while caring for your dog with epilepsy. Anti-seizure drugs work by calming down the brain's electrical activity. Think of your dog's brain like a busy city at night. Lights are flashing, cars are zooming, people are moving. That's all the neurons firing. A seizure is like a power surge, way too much activity all at once. Help reduce that surge by doing one or more of these things. Increasing inhibition, basically telling some of the brain's messengers to slow down. We don't need more signals right now. Decreasing excitation, stopping the overly excited neurons from shouting even louder. Modulating ion channels. This is like adjusting the city's power grid so the energy doesn't spike. It makes the neuron less likely to fire by changing how ions like sodium or calcium move in and out of the brain cells. So how do vets choose which medication to start with? It's not a one size fits all. They look at your dog's age and breed, how often seizures are happening, what kind of seizures they are having, so focal or generalized, other health conditions your dog may have, any other medications your dog is on. And they should be consulting with you to find out how easy is it for you to give them medication multiple times a day. Each drug has its own strengths, side effects, and way of working in the brain. Some are better at preventing clusters, others are gentler on the liver or kidneys. Some work by targeting those ion channels we talked about. Other boost the calming messengers in the brain. And sometimes it's trial and error. What works beautifully for one dog might not work well for another. And that's why seizure tracking is so important, so your vet has data to make informed decisions. If you don't have a seizure tracker yet, check out the link to mine in the description below. In plain terms, most anti-seizure drugs lower brain excitability. They do this by either increasing the brain's natural brakes or decreasing its gas pedals. And some work by adjusting how ions move across the brain cells, which makes the neuron less likely to spark or fire. Now that we know how these medications work in the brain, let's talk about what else goes into the decision-making process. Because it's not just about the science, it's also about safety, practicality, and even access. Some medications are better at reducing seizure frequency or preventing clusters. Your vet will look at research, clinical experience, and your dog's response to figure out which drug might be the best match. Next, safety. All medications come with potential side effects. Some common ones include drowsiness or sedation, increased hunger or thirst, some wobbliness or weakness. But some drugs carry more serious risks like liver or kidney stress, so your vet may recommend regular blood work. The goal is always to control seizures without sacrificing your dog's quality of life. Every medication is processed or metabolized by your dog's body. Some drugs are metabolized by the liver, others by the kidney. This matters if your dog already has organ issues or is taking other medications. Vets are especially careful to avoid combinations that could cause interactions where one drug affects how another drug works or causes toxicity. Even the most effective medication won't help if it's impossible to give. Some prescriptions need to be given 2 or 3 times a day. Some come in liquid forms, others are large pills that can't be split and might be too big for your dog. Your vet will consider what works best for you and your dog because giving daily meds isn't always easy. Cost is another big factor. Some older medications are available as generics and are much more affordable. Others, especially newer, can get pricey. Let me tell you one of my experiences with cost with one of Ruby's medications. The third drug eventually added for Ruby was zonisamide. Based on her weight and another medication she is on, she requires a higher dosage of it to work. Based on the dosage availability of this medication, that meant a total of 8 capsules a day, 4 in the morning, 4 in the evening. That's a lot on top of the 2 other medications that she receives. So when expressing that to my vet, she gave me the name of a compounding pharmacy in the area that I could check with. Basically, a compounding pharmacy could create 1 pill for her with the correct dosage, so 2 pills a day instead of 8. Sounds great, right? Well, I called and talked to the pharmacist and discovered there would be a huge difference in price for the medication through the compounding pharmacy. This is where I had the information then that I could make the decision that I would rather administer more pills than pay a significant amount more money, because I was aware of the options and the details of those options. I got to make the choice of what would work best for me. So maybe if Ruby wasn't so motivated by food, the additional price to administer less capsules would have been more appealing. But luckily for me, Ruby is an eating machine. So more capsules at a lesser price works best because of the cost. And don't forget, tools like GoodRx can help save money, even for pet meds. I use it all the time for Ruby, for all 3 of her meds. If you haven't checked out GoodRx, I made a video all about how to use it. There are also other pet med coupon options as well that you can look into. Finally, what's allowed and approved? The U.S., not all anti-seizure drugs used by vets are FDA approved for dogs. Some are being used off-label, meaning they're approved for other species or conditions, but vets still prescribe them based on solid science and experience. So when your vet recommends a seizure medication, it's not a random pick from the shelf. It should be a careful decision based on science, safety, your dog's health, and your lifestyle, along with your budget. You are part of that decision too, so ask questions, take notes, and keep tracking those seizures. You are your dog's best advocate. I hope this was helpful. Like, subscribe, and hit the bell so you can continue to learn with me as I learn with Ruby.